Hello, everybody, and welcome to the Jerry PT version of PT on Ice. Christina Previtt here. I'm one of the faculty for the older adult division of the Institute of Clinical Excellence. And we are getting really excited because we are 5.5 weeks from our first ever live version of Modern Management of the Older Adult. Dustin and I are heading down to St. Louis, and we are going to be doing all things Jerry PT. Super exciting. And we have our next version of the online Modern Management of the Older Adult course starting in January. So if you're thinking about New Year's resolutions, and one of the things is to do more continuing education, especially in Jerry PT because it's the best. I'm a little biased. That one is definitely something to look for. Okay, so today I thought I would do a little bit of a thought experiment around arthritis. I always think of arthritis like the evil gingivitis. It's the evil arthritis where so many of our older clients, you could probably not go through a day working in the Jerry PT world without seeing an individual with some type of arthritis. What I think is really interesting, and sometimes we don't really think about, is that arthritis is actually a syndrome where it's one of its distinguishing factors is that there is one of the symptoms of the condition is a degeneration of the joint, either at a single joint, wear and tear, or something that's more systemic or inflammatory, which can affect multiple joints. And so because of that, we kind of think of the big five in terms of arthritis: osteoarthritis, rheumatoid arthritis, ankylosing spondylitis, gouty arthritis, and psoriatic arthritis, probably being the majority of the individuals that we see. But some of the autoimmune conditions that have an inflammatory component to them, which can cause a destruction at the joint, such as lupus, can also be umbrellaed under the arthritis term, which I thought was really interesting and really talks to the systemic nature of arthritis. And what we know from a lot of the literature is that arthritis, osteoarthritis in particular, is like gray hair. We're going to see a wear and tear of the joints, especially of those that we are using more often. We tend to see a lot more arthritis in the joints, the small joints of the hand, especially for individuals with rheumatoid arthritis, and the load-bearing extremities, so hips, knees. But I'm starting to see more and more people in my caseload with arthritis of the ankle and shoulder, to the point where I've seen actually a couple of shoulder replacements in my caseload over the last, I would say, 6 months to 2 years. There's been kind of a rise or insurgence of individuals with replacements. So I thought today that we would talk a little bit about the management of arthritis. We know that, especially for our load-bearing joints, that the amount of joint space loss is not necessarily directly correlated to the amount of pain that a person experiences with arthritis. We also know that things like low impact activity and strengthening of the muscles around those load-bearing joints are going to help alleviate some of the discomfort and potentially delay or circumvent the need for joint replacement. And that's where physical therapists can really be actively involved in not only the rehab after joint replacement, but if you see an individual soon enough, you may actually be able to prevent a joint replacement from happening. And so that could be something that's cost effective for our system. The other thing, though, that we're starting to see as some of the literature is developing is that even osteoarthritis, which we generally see as a wear and tear of the joint, has an inflammatory process that is going on with some of the wear and tear. Because of that, we know that there are certain lifestyle-related issues or conditions that are coming up that this inflammation can be managed through some of the things we talk about a lot through the APHPT. When we're thinking about lifestyle-related conditions, the big ones that come up are heart disease and stroke. These are things that are affecting the circulatory system, and we have a lot of evidence to substantiate the use of lifestyle-related interventions to completely ameliorate symptoms of heart disease, peripheral vascular disease, and things like diabetes. But what about if we apply some of these strategies to a condition like arthritis? And so I'm going to go over a little bit of some of the research that we're seeing around lifestyle-related interventions and things outside of the world of exercise that may be able to help individuals. Okay, so one of the things that we're seeing, as I'm going to let my dog into the room, for individuals is the weight management. And so a study was done in the US where they asked patients in physical therapy what kind of lifestyle related conditions or what kind of self-management or health promotion strategies do you think is appropriate for a physical therapist to be talking to you about? And they said that a lot of things were fairly appropriate and they would be receptive to these conversations. But the biggest two were obviously physical activity and were actually weight management. And obviously because physical therapy is in the physical dimension, these were not surprising findings, that talking to your physical therapist around the physical changes that need to be happening in your body to ameliorate pain and improve function were seen as advantageous. So from an arthritis perspective, we always know that if we have increase in adipose tissue, being either overweight or obese through BMI, that we are putting extra force on the joints and it can accelerate the development of arthritis. What we also know that is surprising is that it can also accelerate the development of arthritis in our hands. Obviously not to the same extent as a load-bearing joint, but I thought that was very interesting that there was also an increased risk of osteoarthritis in some of the carpal metacarpal joints in the hands. And that got me questioning because we often say that it's just a force transfer, that if we have extra weight that we're carrying around, we're placing more force on the joints, which is going to obviously accelerate that wear and tear. But there has to be also something else going on in order for that to be also accelerated at joints that would not necessarily have that same force transmission. And so what we're starting to see is that with adipose tissue, it's a very inflammatory tissue. And so it's going to increase the amount of inflammation, low-grade inflammation happening throughout the body. We know that in terms of cardiovascular disease and diabetes. So that low-grade inflammation must also be having some sort of systemic effect on some of the smaller joints, including the joints in our hands. And so talking to our clients about weight management, which can sometimes be an uncomfortable conversation, and it might not be something that you bring up day one, but not only talking about it with our clients who have hip and knee arthritis, but also talking about it with just systemic or osteoarthritis in the hands or feet. This was really interesting because even I saw this in my dad. He went to a surgeon and the surgeon said, I can either replace your knee or you can lose 30 pounds. And so he decided to lose the weight and the pain in his knees disappeared. And so he's almost like an advocate for me because it just shows the power of some of that weight management and that weight strategies that can help ameliorate some of the pain symptoms. The other thing that we know is that people who are physically active, irrespective of what they do, are more able to handle the pain related to arthritis. There was a really cool study that was done in individuals, I believe it was rheumatoid arthritis. I'm forgetting some of the fine details of this study as I'm speaking. And they asked people, what is your pain on a scale of 0 to 10? So they gave an MPRS rating and said they had groups that said I'm a 4, a 6, a 7, and they categorized them. They then asked individuals, how physically active are you? Are you reaching the physical activity guidelines? And they dichotomized people who are physically active and people who are sedentary and were not physically active. And then they gave them a series of quality of life measures. And what they showed was individuals at the same level of pain. So this person rated their pain at a 7 out of 10. This person rated their pain on a 7 out of 10. And the only variable that was different based on their logistic regression was that one was physically active and one was not. Their quality of life scores in people with the same pain rating was much higher in individuals who maintained their physical activity levels versus those that didn't. So even non-specific physical activity interventions help individuals manage the pain from their arthritis, and still being able to move and be physically active enables people to feel like they still have some control. This is my guess as to why the quality of life is so much better. I know that even if I'm dealing with an injury as an athlete, still being able to do something is better than just sitting on the couch and doing nothing, because I just feel like all I'm thinking about is my pain. And so trying to encourage some of our clients to be physically active, that could be, in the pool, find a low impact option for aerobic exercise, try and get them to do even a little bit of physical activity and say, not only is this going to help you deal and manage with the pain that you're having from the arthritis, the strengthening is going to improve some of your symptoms. And just because you're experiencing some of the pain from arthritis doesn't mean that the benefits of exercise for keeping our hearts, brains, all of our circulatory system healthy is going to go out the window. We still need to consider those things. So I thought that was really interesting. The next healthy lifestyle factor that we think about is sleep. And so we know that a lot of our recovery processes happen through sleep. We also know that when people are really struggling, especially with very chronic, strong pain from arthritis, it can affect their ability to fall asleep. And so if you're not sleeping, you're not recovering. If you're not sleeping, you're probably pretty grumpy because you're not able to feel rested and recovered. You're feeling sluggish and fatigued, which just makes us think about pain even more. And we can get into this really nasty negative spiral. And so talking to our clients, there's a couple of validated outcome measures around sleep quality and talking about sleep hygiene and trying to give some, strategies for individuals to get some sleep. Whether that be, some people you can put a pillow in between their legs and it helps with some of the pain in the hip, for example, or, trying to get to bed a little bit earlier, knowing that you might have a little bit more trouble falling asleep, things like that. Can really help, again, with that self-management piece when people are in lots of pain around arthritis. The last healthy lifestyle factor that I wanted to talk about, and I think this is really interesting, is nutrition. And this is sometimes outside of the scope of practice of physical therapy, but I think it's something that we need to be conscientious of, that if we have individuals who are not on a very well-balanced diet, that it can actually exacerbate pain from arthritis. There was a longitudinal cohort study that was done in individuals with rheumatoid arthritis. I believe the study was published in 2014, where they asked them about their adherence strategies to different types of nutritional interventions, nutritional ideologies, and then they asked about pain irrespective of whether or not they were getting any sort of rehab or physical therapy intervention. And what the study showed was individuals who adhered to a Mediterranean-style diet had decreased pain and increased quality of life, controlling for level of physical activity and rehab activity. So what that means is that irrespective of what their rehab goals or rehab interventions are looking like, just a change in their diet strategy to something that's a little bit more whole foods focused and looking for healthy sources of carbohydrates and adequate amount of protein was enough to see a decrease in pain. This obviously has to do with the fact that a rheumatoid arthritis type presentation is more of a systemic inflammation. So if we're adhering to a diet that has anti-inflammatory properties, we know that a Mediterranean diet, for example, is heavily biased in fish and omega-3s, that we're seeing an anti-inflammatory effect, which is subsequently causing a decline in pain and an improvement in quality of life. The other thing that's really neat about that is it may be a chance or an opportunity for us to have a multidisciplinary approach to arthritis. Something that we think potentially is only in the wheelhouse of physical therapists is something that we could potentially bring an RD into the mix. We could, have them have some nutrition counseling and see if that can accelerate their improvement with our interventions. So we're kind of tackling it from multiple angles where we're working on, getting individuals stronger and using our tools in our toolbox to manage some of the pain of arthritis, but then also allowing our colleagues in the nutrition realm to be helping them as well by doing even little tweaks to their diet that can make a huge difference. So that was just my thought process. We have a lot of tools for arthritis, but it's really cool to think that there's other lifestyle related conditions that can have a trickling effect. So if we're encouraging people to be sleeping more, drinking less, not smoking, being physically active, having those social supports and making sure that they're adhering to a well-balanced diet, not only can we potentially improve the physical ailment or the arthritis that individuals are looking to us to help treat, but we can also be encouraging them to, have a reduction in risk for these other lifestyle-related non-communicable diseases like heart disease and diabetes. And so they're both going to work together in a positive feedback loop, because sometimes I think with the pain, fatigue, lack of sleep, and sedentary activity, we tend to see this negative spiral more likely when people are in chronic pain. But in this instance, hopefully we can try and push them out and break that cycle, that negative cycle, and build a positive feedback loop where all of these healthy lifestyle factors are working together. All right, that is it for me for today. I hope I gave you guys something to think about. The studies are still very new, and there's more and more coming out all the time, which is super, super exciting. If you guys want to continue this conversation, tag me in the comments. Otherwise, I hope I meet some of you either in St. Louis for the course or online, and have a very happy Halloween. Bye.